right, I will call to order the Board of Health meeting of Wednesday, July 13th, 2022 at 6 p.m. So we have two sets of meeting minutes for approval. With Dave being absent at this time, we will table the minutes for June 1st of 2022, and we will review the minutes from May 2nd of 2022, which you and I were present for, Dina. Did you have an opportunity to review those?
I did.
Okay, perfect. So I will entertain a motion to approve the minutes of May 2nd of 2022 as written.
I'll make the motion as stated.
And I will second it. Any discussion?
No.
Nope. With there being none, roll call vote.
Dina Costa, member, yes.
Carrie Singer, chair, yes. Minutes approved. And we'll table the 6-1. All right, next on our agenda, we have 3 local upgrade approvals for review. Were we waiting on the engineer for 39 Brown Road?
Yeah, I believe she was going to be in attendance. I have not seen her on Zoom yet, so do we want to do the others first and see if she jumps on?
Sure. So let's, we'll just in the interest of waiting for the engineer to pop on Zoom for 39 Brown Road, we're going to jump to 10 Holman Street. This is a reduction in separation between SAS and high groundwater from the, down to 1 feet, right?
So from 1 foot separation,
Yep.
so 4 feet instead of 5.
4
5
feet instead
yep.
of 5.
And other than that, the plan has already been approved.
Okay, it's
no
been
other
reviewed,
concerns.
no other
Yep.
concerns or issues. Okay.
And the reason it's 5 feet instead of 4 is because it was a less than 2 minute per inch per grate.
Okay. And is this a
It's a repair.
repair?
Yep.
Okay.
This is a barrier.
Looks like a tree line, sloping down. Okay. And the local upgrade. This way here. Great. Any questions on the plan? No. Okay. So I will entertain a motion to approve a local upgrade approval for 10 Holman Street with plans drawn up by DC Engineering, Jason DuBois, received on June 9th of 2022 for a reduction, reduction in separation between the SAS and high groundwater from the required 5 feet down to 4 feet.
I make the motion as stated.
I will second it. Any discussion?
No.
Nope. With there being none, roll call vote.
Dina Costa, member, yes.
Carrie Singer, chair, yes. Local upgrade approved for 10 Pullman Street. Okay. All right. She's not on yet?
Nope.
Okay. Next is another one from DC Engineering. This is 11 Homestead Ave. This is a request to allow tank pipe angles to be greater than 22.5 degrees.
And you can see there's just a one quick 90. It comes out of the tank and then turns to head right into the D box. And currently, our regulations say that there can be no bends from the house to the tank, and there can't be any bends greater than 22.5 degrees from the tank to the soil absorption system. However, at that point, it should all be water. Should all be effluent.
Was this a pump? Because there's a pump?
No, that's the tank. Yeah. So it's just the way that it comes in,
Yeah.
and then it comes down and around.
So you have that slight bend.
Yeah.
Right after the tank. So it's also
There's this one, and then there's this one too, right? Is there 2 bends?
is this the? Oh yeah, I was thinking of the.
Right?
Yep.
So we've got a bend here.
Yep. And then right
And
there.
then right there. Okay. So is that, that was written for both, right? It just says to allow pipe angles to be greater
Greater
than,
than,
so
yeah.
I'm gonna say
And to
angles
be
is
honest,
plural, so.
I don't know, this was something I found, like, I didn't realize we had in the code until recently. I
Yeah.
know that, I don't know if Steve Donatelli has really looked at it
Okay.
that closely before, because there really isn't much of a concern. So, and this was the one that was an emergency repair, so they've already begun work on the system.
Okay.
But,
Yep.
those were the.
So that was it, it was just that, just the bends?
Yep.
And this is pending his approval, Steve's approval.
So I've already reviewed it and it's all set.
You reviewed it.
Yep.
Yep. All right. So I will entertain a motion to approve a local upgrade approval for 11 Homestead Homestead Ave for plans drawn up by DC Engineering, Jason Dubois, received on June 9th of 2022, to allow for tank pipe angles to be greater than 22.5 degrees, and based on the plans, that would be two angles greater than 22.5 degrees.
I make the motion as stated.
I'll second it. Any discussion?
No.
Nope, with there being none, roll call vote.
Dina Costa, member, yes.
Carrie Singer, chair, yes. Local upgrade approved.
The Town Forest Road is quite a large plan. That's the next one.
Okay. So Town Forest Road, soil extension request.
What's that one?
So this is a new construction?
Yeah.
Tell by all the plans.
Yeah.
So is this a vacant lot, or they're building, you said?
Yeah, it's a new
Yes.
construction.
And so it's gonna, Steve is the one that reviewed this one.
Okay, so he's reviewed it.
Yes, and he has no issues with it. So this is, I don't know, these are like the specs of it.
Yep.
But it's really just to allow the extension of the soil testing. So, let's see, is that construction layout? Commercial.
So this is to find out the high groundwater, this test?
No, so they had a perk test done in November 2019. And our regulations differ from Title V in saying that perk test data is only good for 2 years.
Okay.
And so they're just asking to use the perk test data and the soil data from 2019. And the soil area has been undisturbed.
Okay.
Steve went out, he has no issues with it.
Okay. So they just want to use the 2019 data then?
Correct.
Which was previously.
And nothing has been here?
Nope.
Nothing, they haven't started construction, so nothing has been touched?
Right. I think
Okay.
they have started some construction for the building, but nothing that would change the soil
Okay.
layers or impact high groundwater. So Title V actually allows for any soil testing data done after 95, as long as the soil hasn't been disturbed or anything has
Okay.
affected the landscape, then the data is actually good for technically forever.
Okay.
Should just sit here.
Yeah, just sit there. Just swap your nameplates. So this is a commercial building?
Yes.
Okay. And what exactly is going in here?
I said, let's- Should do that. I said Steve has reviewed the plans.
That's what I'm not sure, yeah. These are all like clear.
We do have multiple lots on this being
So is it a
developed.
housing development?
No, it's,
Okay.
I'm pretty sure it's commercial, based on proposed building, that you have the 3 bays for the service, I don't know if
We
if
just
it
don't know
has a
what it-
set use yet. So it's gonna, district is industrial use, auto sales, auto service, wrecking, junk, scrap.
So undisturbed, no construction sense,
Yeah, I think we're.
nothing to affect the soil,
No.
nothing to affect the groundwater.
I think we're okay, yeah, I think we're okay with that. So this is Quinn Engineering.
Yes.
Now, do we have updated plans, or do we need updated plans? I'm just seeing that, because this was dated 2 years ago.
Steve did approve it. I wonder, it could have been that,
It would be the same date here.
I'm assuming that these plans were already drawn up.
For soil testing, I don't know that you need new plans.
Yeah,
Do
you
you?
probably don't.
Because I mean,
I mean, nothing's changed, so we should, and the
So-
plans are still okay, being 2 years old, right? Okay.
Well, that's why they get reviewed again.
Okay, so just reviewing them is okay?
Yep.
All right, just making sure that, and they haven't done anything in the last 2 years?
Right. So a lot of times that'll happen, they'll drop the plans, right, and then it like they don't do anything, but then they need the plans reviewed again. So it can be that they submit the same plans.
Okay.
and so for this vote, we're not approving multiple septic plans, we're just approving the soil test. Okay.
Yep.
Yep, to basically just reuse the soil test from 2019.
Yep.
Okay. But everything
But they
else
can
is
design
fine?
the system based on that soil
Correct,
data.
okay.
Yep.
All right. And then if anything changes as they're doing the plans or whatnot, they'll come in front of the board again if need be.
Yeah, it's more, so the
But-
only thing that might happen, which Steve doesn't anticipate happening, he's more familiar with it, is that when you begin the dig out of the system, right, because the deep holes are only in like a small area, and where you actually dig out is much larger, so sometimes you'll come across soil you don't anticipate. I don't anticipate that happening here, but either here or anywhere else, if that happens, they need to notify the engineer and they need to notify us.
Okay. All right. Sounds good. All right, so I will entertain a motion to approve a local upgrade approval for 8 Town Forest Road with plans drawn up by Quinn Engineering, dated January 17th of 2020, for a soil extension, to reuse the soil testing from 2019.
I'll make the motion as stated.
I'll second it. Any discussion?
Just that this application says 11. Town-
Yes.
Probably the mailing address.
So the property locations, if you look here, it says 8 Town
Okay.
Forest, so they
Gotcha.
must own that and then.
Get mail here.
Yeah,
Okay, gotcha.
so that must be the owners, who probably lives next door.
Okay, sounds.
Okay, good catch. All right, with there being no other discussion, roll call vote.
Dina Costa, member, yes.
Carrie Singer, chair, yes. Local upgrade approved.
Oh, hold on, I'll take that to.
I don't want to fold it too much. Big plan there. Okay.
Liz hasn't jumped on, I feel like we can still go ahead and.
Perfect, so, we will jump back up to, 39 Brown Road. This is a Clearwater Environmental, engineer Liz, Dupree. So there's 2 local upgrades on here?
There were 3, but one is that it's an Elgin, and so
Okay.
they're allowed to have 2-foot separation instead of the groundwater instead of the 4.
Okay.
And at last meeting, it was decided that
Right.
that wouldn't need to go in front of the board, but you're welcome to still vote on it since it is.
Okay. So the big ones here, the SAS from existing wells
Yep,
and the use of a sieve analysis?
exactly.
All right. Yeah, so we don't have to worry about this one because they have the Elgin system. So it's kind of inherent, yep. So it's the use of the sieve analysis, which is kind of a given, and then the SAS from the existing wells. So 52.2 and 50.5.
So one well here.
I'm assuming that's the owner's own well.
Yep, so it's the owners, and then the other one is the neighbors, and we have received letter.
I was gonna say,
That the abutter was notified via certified mail about the date of our meeting and that the distance from the well.
Okay.
So the neighbor was notified.
Okay. I mean, what we've done in the past when it's close like that is not require but recommend water testing for both the owner and for the neighbor, but not require them, just because of the distance.
Yeah.
What do you think?
Yeah, definitely.
Yeah. So there's this, so it's 50.5 to the owner's own, and then 52.2 there. There's really no other place to move it, because you have wetland here, and even if you moved it, yeah, and even if you moved it down here like this, it's just a tight lot the way you have it.
Still gonna be within the 100.
Yeah, exactly.
Okay.
So there's really not much.
Nowhere to go.
Really, not much you can do here. This has been reviewed.
Yes,
Okay.
and it's all set. And the previous system was in the front, but there were some issues there, and I think they're getting a lot of runoff, which was causing issues with the system, which is why they moved it back. And it's
okay.
preferable not to put a new system where the existing was. Sometimes
Right.
there's no other option, but
Okay. So they did have it in the front. All right, and then they're gonna put a barrier, because that would be my other, so they'll put a barrier all the way around here.
Oh, comes all the way down here for this well. That's great. Is this the barrier? I
No,
think so.
this is the barrier right here.
What is this?
So that would be.
Erosion control barriers or erosion?
Yeah.
Okay.
Yeah,
So not
probably,
runoff.
because you've got the wetlands there. So, but they're at least putting it around,
Mhm.
all the way around this way, which is
Mhm.
good.
I'm good with this.
Does the sieve analysis have to be on here?
I noticed that too, and it should be. But there was, I think, one other small revision I needed
is
Liz
soil
to do,
testing.
so. Because that does require going in front of the board, so it should be noted.
Yeah, I don't see it anywhere. Do you see it anywhere? It should be listed under. And
The
has this
local
already
upgrade.
gone to conservation? Or does it need to go to
It will
conservation?
go, it will. Yep.
Okay, but it has not gone yet.
I can't remember off the top of my head if they've seen, I'd have to go back to the minutes from
Okay.
conservation. I don't think we've gotten a green slip yet from them, so I
All
would
right.
say.
Well,
it
we
has
can always
not.
make it contingent upon their
Their-
final
yep.
review of the plan as well.
This is just the unit and the soil.
Yeah, so, I mean, we know that they've used the sieve analysis, right?
Yep, it's in their application.
Which is this one.
Yep,
So,
and I've received the results.
okay, I mean, as long as use of a sieve analysis. So, I mean, we can always make it contingent upon them actually adding it to the plan.
Okay.
Just so that it's there. Because I don't see it anywhere. I just see everything for the Elgin system, but.
I mean, it says it right in the perk loading rate, but it really should say that it needs a local upgrade approval.
Okay, all right. All right, so, any other questions?
No.
All right, so I will entertain a motion to approve a local upgrade approval for 39 Brown Road. And that would be for 2 local upgrade approvals. One is the use of a sieve analysis, and the second is a reduction from the SAS to the owner's own well and the abutter's own well from the required 100 feet down to 50.5 to the owner's own well and 52.2 from the neighbor's own well. This will be contingent upon conservation's review of the plan, and also the addition of adding the sieve analysis under the local upgrade approval requests as it is documented in the application.
I make the motion as stated.
I'll second it. Any additional discussion?
Just that we would recommend but not require baseline water testing for both the abutters and the owners.
Perfect, thank you. So I'll amend that, that motion to include recommended baseline water testing for both the neighbors and the owners' water testing. Okay, so with that, any additional discussion? Nope, okay, I will call for the vote.
Dina Costa, member, yes.
Carrie Singer, chair, yes. Local upgrades approved.
Is that the one that the zone was supposed to be for?
Yeah,
But they
yeah,
didn't? Okay.
yeah.
Thanks, Shane.
All right. Next on our agenda, we have Oxford septic regulations, and this is just a discussion about the prohibition of the bends in the lines, which, to be honest, we've never really had those come forward to us before, so, knowing that they're in our regulations, so.
Right, so I was just gonna read the regs. It
Yep.
says the line from the house to the septic tank shall be run straight with no bends. After tank, angles greater than 22.5 degrees shall not be permitted. So, a couple engineers have already expressed concern that they're now gonna be coming in front of the board for a lot more things. I know I spoke to Steve about this, and as I've stated, it really should just be effluent after the tank, it should just be water. So, he doesn't really have any concerns with bends, so I was wondering if the board would allow Steve and I to approve those plans if there are bends. I generally try to avoid 90-degree angles if possible, and if there are 90s and they're not close to the tank or anywhere else, I sometimes ask for them to have a clean out, just in case they do need to get in there. But 22.5 is pretty extreme. Obviously, I'm not asking to change the regulations at this time, but just allow Steve and myself to approve those without having to bring those in front of the board every time.
Yeah, I mean, I don't see any issues with that. I mean, I think as long as we set the standard that if they are greater than, what'd you say, like?
Or you could say greater than 45.
What would that be your area of, like, your concern with a bend?
Yeah.
Like, what would you be concerned about most with a bend?
Well, I mean, it technically should just be effluent, so I have some engineers that will say whatever bends, it really doesn't matter after
Yeah.
the tank, right? It's more towards the tank that you're more concerned. I just think on the safe side, if you can avoid bends, it's just better.
Yeah.
And so, even a 90 is pretty sharp. So if you try and do 245s instead of a 90, it just eases that flow a little bit.
Okay.
And so the clean out is something that they put into the build, so if they notify you or Steve, you can recommend that they
Put a
in
clean out,
Okay.
yeah. And so the clean out, and it would be marked on the plan, and it's really just like a pipe that sticks up. It'll be almost to grade, so that you can pop it open and look down into the system.
Okay.
I mean, I'm more than happy to keep bringing these to the board, but I also,
Yeah.
I don't know if it needs to take up your time if it's a plan just for the bend.
Yeah.
Right, I think it's fine. I think if there's a cause for concern, or if it's greater than 45 degrees, maybe have it come forward.
And we can also always include it if they're already coming for another
Right,
variance,
right.
then include it at that
Okay.
point, but if that's the only thing.
Yeah, if it's just a bend, then
Okay.
I think,
Yeah.
what do you think?
Yeah, I think that's fine, as long as they know, that, it's gonna be reviewed in the plan itself, and you or Steve have the ability to recommend the clean out. I think
Yep.
that's fair.
Okay.
Yeah, I think so too. All right. So do you want us we'll vote on that?
Yeah, that'd be
Okay.
great.
So I will entertain a motion to allow Steve Donatelli and/or Rika Sterrett to approve septic plans that include local upgrade approvals with bends greater than 22.5 degrees without having to come forward in front of the board unless there is area of concern or the bends are greater than 45 degrees.
I make the motion as stated.
I'll second it. Any discussion?
So is it that the owner does not need to make a local upgrade request?
They still technically should put it on there because it's in our regulations,
I
but that
see.
it doesn't, that the board gives Steve and I permission to
Yeah.
approve those local upgrades.
Without being,
Instead
okay.
of coming
Yeah,
Got
forward
it,
to us.
okay. So they'll be noted on the plan and, okay,
Yes.
got
Yeah.
it.
Good. All right. Any
That
other
was it.
discussion?
No.
All right, awesome. With there being no more, then roll call vote.
Dina Costa, member, yes.
Carrie Singer, chair, yes. Okay, all set.
Awesome.
Interesting.
All right, next on our agenda, we have a body art regulation. So this is a continuation from our last meeting, which was our June 1st meeting. So we're hoping that we can try to wrap most of this up. This has been like ongoing now, but the way we go with regulations, it doesn't surprise me. So, so Rika, you were able to provide us with trainer guidelines from the Society of Permanent Cosmetic Professionals, SPCP, and also from AAM, the American Academy of Micropigmentation. So that will help support some of our decisions as we try to finalize these regulations with regards to body art and cosmetic.
So page 15, I think that was where the biggest hang-up was.
Yep.
So, because that, the bottom, the 6A, talks about completing a training course of at least 100 hours that is accredited by one of these organizations and kind of what it needs to include. And then the hang-up was, the last item is hands-on practice of at least 3 complete procedures. And the body art practitioners that we have in town came forward and said they felt like that was a little bit too much. So we were told that 1 is common, but looking through like their curriculum and reaching out to them, like the AAM, they noted that at least 2 out of the 6 student procedures or 1 procedure for each technique being taught, if more than 2 different techniques are being covered, need to be directly supervised by a trainer, and then other 4 can be done on their own as long as pictures are sent to the trainer.
Yeah.
And that was similar to the Society of Permanent Cosmetic Professionals, where they have, it would be 6. But again, I think it breaks down because the fundamental course, they have it where it's both eyeliner, brows, and lip liner, so it would be 2 for each. But they, as they noted in their email, they always support increased hours and procedures. So I think 2, I would say at least 2. Hands-on, being overseen by, should be based on their curriculums.
So are we safe by just saying that if they've completed training from either one of these, where it already is spelled out here that
That
they've
you don't
done
necessarily
to?
need to get rid of the.
I think so. I mean, we have documentation of it.
My only concern is that we have a practitioner who took a class that was supposedly accredited by AAM, and she claimed she only did 1 hands-on for the class. So that would be my only hesitation.
Now, my only question with that was, I know that during times of COVID, a lot of stuff was not hands-on. So
That's true.
I have to think about that element of it, because in reading some of these emails, they did talk about how in the perfect world, it would be this, but
Yeah.
where they've been limited with some of that during those years, that it would be hard for them to get the hands-on, and sometimes they would do them like over Zoom or photographs and whatnot. So, I mean, just looking at their, like reading what their standards are, I mean, because even on this curriculum down the bottom, it says 6 student procedures or 12 procedures if using shared model method. So, I mean, according to that, I say they're doing 6, right?
On live, those are on live.
It says,
models.
yeah, it says,
But only 2 technically have to be done with your supervisor
correct.
there.
Which would
According
be
to the
from
email.
beginning to end.
From beginning
Yeah.
to end. And then the others you just need to send to your pictures after you've completed it to
Yeah.
your instructor for the other 4.
And it sounds like they document all of this. So when the pictures are sent in, like that, the trainers have documentation of
They
this.
should be. Yep. You could get, I'm just looking at reading it, you could just say the applicant must also provide documentation of the training course, including the training institution contact information, documentation of the certification accreditation, and a copy of the course curriculum, showing that the course meets the certification accreditation requirements, and then get rid of the
Right.
rest.
That's what I'm thinking. I mean, everything is here. They get some sort of certification when they're done. Where did I read that?
And you're saying, Rika, take out 1 through 8?
Yeah.
Because it's all built into their curriculum.
So my only concern with that would be if another pop-up organization comes up, or it's something we're not familiar with, or, I mean, this just says, at a minimum, these basic, like,
But it still states those 2 organizations. I mean, we could try and change the verbiage.
so we're requiring that it's from these 2 organizations? Okay.
Yeah.
And I think if it's another pop-up organization, because I agree, this is becoming more the trend now, that we're gonna have all these organizations
Right.
that are gonna start to develop it.
Right.
That if it's outside of these 2, we need documentation of what
information.
their curriculum entails.
And you could always say that falls under the variance, but we can also
Yep.
include other language that say if it's another accredited program.
Yep.
I think we should.
Curriculum needs to be
Yeah.
provided to the,
Yep, and reviewed by the Board of Health prior to it being put in. What do you think? I
Okay.
think that gives them a little bit of,
Gives them some leeway.
Yeah.
So if it's 2 or it's 3,
as long as it's
According
built
to
into,
that, yeah.
correct.
okay.
Because, I think they're getting the experience. It's just different than what we're used to that hands-on experience to be. Yeah, I think it's fine. I just want to make sure that we have this documentation and we keep this. And then if we need to add any additional accredited organizations, then we can revisit that if we need to.
or by putting in if another accredited program, right, that kind of covers everything else.
Right,
that
and
we
if
might
someone's
approve.
reading this and they went to another school, then they know they have to get us all that information prior to.
I'm good with that.
Yeah, okay.
And you can see in red, I added, based on their comments, successful completion of a tattoo training course.
Yep.
However, there's no this microblading and permanent cosmetics, they actually have accrediting organizations, where tattoos, you don't really have that. So they would also have to bring any curriculum to the Board of Health for approval.
For regular body art, outside of cosmetic.
Yep.
Okay. Yeah, that's like another, so I like having it vague enough where if they've gone through that, they should submit that to us so that we know.
And I also, so 15 to 16, I changed it where it's one or the other, right? They either need to have the course or they need to have the apprenticeship.
Yep, okay, one or the other.
Yep.
And that would be documentation of an apprenticeship.
Yep. And for other practitioner experience, for other body art, it's a list of different things, including apprenticeship or a course or other permits, that you've done the work before. There's a variety of different options.
Okay.
I think those were the big things that I
saw one other red one over here, which was, this was the
Oh, yes.
application for the guest.
And I wanted to change the I was reading through and I was like, ooh, I don't like how it reads. I was gonna say last 3 prior places of employment as a practitioner.
Yeah.
That
Yeah, I agree.
flows better.
It took me a few times reading
Yes.
reading that one to go, wait a minute, what?
And then,
And they just have to list them with a phone number and the contact person, is that what we're asking of them?
we just had, of that previous place,
Yep.
that is not included, but we definitely can, last 3 prior places of employment as a practitioner, including contact number for those places.
I mean, yeah, I would put a contact number. Therefore, if anything were to happen, we at least know where and it's not a bogus.
That you can follow up.
Yeah.
Yep.
I mean, yeah, it's great to have a name, but like the actual establishment, but
So you could word it 3 employment references, including contact and address.
Something like that.
But the question is, do you want an actual reference, or do you just want a list of the places with contact?
A list.
A list, I think, is
Okay.
fine. I mean, I kind of think a list is the reference to me. Like, you know, when you do a reference request, you just list the names and phone numbers, and so however you word it and we put it in there, I think it's 6 of one, half dozen of the other.
And then my other question for that is an application fee paid to the board at the amount set by the board. So this is for the guest.
Okay.
The-
Have we looked anywhere else on what they do for guests?
So I looked, and there's not many that do guests. The one that I was clearly able to find, their permit fees are higher. So their establishment was $250, practitioner was $200, guest was $100, and we're $150, $100. So I was thinking maybe $50
Yeah.
for guests, because it's really only for 14 days.
And if they go beyond 14 days, do we charge them another 50, or do we just grant an extension? Because I could see that that may happen as well. I know a lot
And
of
then-
guests just do it for a short period of time.
But then the question is, at that point, do you just grant them a practitioner permit? Because that's now 100, like, you've set that amount. So I would
Right.
present it to someone, it's 14 days, but if you want to be here longer than 14 days, even if it's like a month, you're better off getting just an annual.
So right now we do 150 for the establishment and 100 for the practitioner. I'm even thinking 50 might be kind of steep, to be honest. I mean, they're paying $100 for a full year. You're paying $50 for essentially 6 months. They're only there for 14 days. I mean, we can always reevaluate it.
You can set it lower, and then
I just don't want to, I don't want to detract them like from getting guest practitioners, because by them getting guest practitioners, then they're able to potentially hire off those guest practitioners.
I just also view it though, and I'm not saying, like, I'm fine with
Yeah.
wherever the board sets it, and I agree, I'd rather have them permitted than not. But it also, is there gonna be much difference in time, maybe a little bit, but not much, between reviewing an application for a guest versus, a new practitioner for an annual, you know, because they have to provide a lot of the same documentation of experience and training. I mean, when it's a renewal, it tends to be a quicker review,
Right.
and you still have that inspection. But we could do 25, and then we could see, like, I'm sure
Let's see
body
how-
art it's changing rapidly, so I'm sure that there'll be other communities at some point that will have guests, and we'll have a better comparison.
Right. Because the other thing I'm thinking of too, and I know it's like a hard comparison, but I just have to think about it. So if we do like a one-day food truck or anything like that, what do we charge them?
That might be 50. I think it's 50.
Okay. I'm just trying to think of the timing it takes to do something like that. With this, I'm just trying to think about
Food
it.
truck, we have it split. I think it's, if I remember correctly, I think it's 50 for 1 to 3 days, and if it's like 3 to 14 days, it's 100.
That also involves a physical
Inspection.
inspection. So they're actually physically going to the food truck to do an inspection, where this is more paper
Reviewing.
review and not actually going there. I don't know, what are your thoughts? My gut tells me 25 to start, and then if you're getting inundated and you're finding, like, I think take, like, maybe almost do a time, like,
Yep, see how-
see how long it takes to review them, and then we can always reevaluate it.
Of course, we always look at the fee schedule
Yeah.
too. I mean, we glance at it and it's reasonable.
I'm just trying to think. like for 14 days, it's paperwork, there's no physical inspection.
Then the question is, should there be a physical inspection? I'm not like, I don't know if the capacity, we've never done it before, but, right, should you be checking that their workstation is appropriate, right?
But we would do an inspection of the facility, so it would be up to the establishment
Yep, which
to
it's
maintain
under.
that, right?
Yep,
So, because do you do an inspection of new practitioners that come in?
No, but that's the question, like, should we be doing that, right?
I think it should be,
No, they're practicing under that permit for the
Yeah.
establishment, so if there's a violation, right, it would technically be
It
under
falls
the.
under, yep.
The
The establishment.
establishment.
Mhm.
Yep.
I mean, ultimately, it doesn't matter, their practitioners, guest practitioners, they all fall under that, so.
Yep.
Okay.
Perfect.
All right, so we'll do 25, and then we can always reevaluate it.
Yes, I think that works good. And I think,
I think that was all the red I saw.
yeah, I felt like there wasn't too many changes. I didn't know if anybody else had any other comments. I mean, though, the things that we're changing is, right, like the practitioner is now gonna be yearly versus every other year.
And then we have our information about variance,
Yep, in the back.
which
the
is
last
there.
one, yep.
So that gives them the ability to be able to come forward if there's anything in here outside of that. So we talked about that. That's fine. I think everything else was. All right, have we received any communication from
Victoria.
Victorian Inc. with
No.
regards to this or anything that they
No,
felt?
I sent it to them after the last meeting. I had made these changes that you see in red. I sent
Yep.
it to them. I hadn't heard anything. Actually, I did do their inspection.
Okay.
So it was great. It was great to. That
Okay.
was my first time really out there, seeing it. Jay gave me the tour, and they had said they would be here tonight. So I hadn't.
Okay.
No other comments from them.
All right. All right, so next steps here.
I mean, I'll make the changes one more time, the couple of edits. I'll send it to you, and then we can just vote next month just to approve it.
Yep, so actually what I'd like to do, and that's if you think this would be acceptable, Dina, as well, is make the changes, send it to us for final review, and also send it to Victorian Inc. for final review to let them know that
Yep.
we will be voting.
To approve this.
Voting to approve it, and then if they have any issues, just like they can come, but if they don't want to come, they don't have to come. Like, and we told them that at the
Yep.
last meeting. So I think they've been helping us out a lot, so I'd like to give them the benefit
definitely.
of reviewing them.
I'm good with that.
You good with that? Yeah, and then we'll set it up for final review and approval at our August meeting.
Okay.
That's a good feeling.
Yeah, I know. Thank goodness.
Get excited though, because there's more regs down.
I'm sure. More regs down the road. All right, perfect. Okay, so next on our agenda is our director report out. So
Yes.
COVID-19, shared services grants, office updates.
Yep, so COVID-19, we were looking good there for a while, but our wastewater numbers seem to be slightly trending up again.
Really?
And there is that new variant that we're keeping an eye on. And I got the testing results, weekly testing results today, and so our positivity rate is 7.5%. So of those tested, 7.5% are positive. But that doesn't include home tests. Those are just the ones that are reported to Maven. Overall, I mean, we're not getting a lot of cases through Maven. I feel like it's holding pretty steady. We're not inundated, but that wastewater does seem to be, we were trending downward for a while, and it was looking good, but seems to be just slightly, so keeping an eye on that. And then just to add to that, I just wanted to you've probably, I mean, both nurses here, monkeypox is now on our radar as well, that's being discussed. So it's not a huge concern as of right now. We don't have anybody in town or any close contacts at this time. The state currently is handling all cases, but they've already told us that as the numbers are increasing, they'll probably be calling on locals to help, at least checking in with any close contacts. The state is receiving vaccine for monkeypox, so anybody that is deemed a close contact will be getting, I believe, will be having the option to be vaccinated, or certain high-risk individuals that are close contact.
What defines a close contact?
Oh, that's a good question. Katie Brown mentioned it to us. It's a lot, it's a lot less stringent than COVID. Like, you really have to be in close contact for an extended, I want to say it's like 45 minutes or something like that. It's an extended period of time. It's not nearly as strict as COVID was, but I can get that information to Katie Brown. Dr. Katie Brown, the state epidemiologist, did a presentation for us. And so it's just being aware of it. If you feel like you have any symptoms, talk to your primary.
And I saw you've been putting it on social media too.
Yep,
so
just
I
making,
saw that.
Yep. And then, so shared services, we've had some not so good news. So our shared service public health nurse, Alyssa, actually left. She's still per diem, kind of as we need her. But so we posted for the job. We have a couple applicants. And so we're hopefully going to be trying to bring someone in. And then Lori, who was the community health coordinator, also gave her notice. So we're going to discuss what we want to do with that position. There is the potential that we might be looking for like a community health worker, social worker, because a lot of the communities we have a lot of hoarding cases and stuff like that come up, where social worker, community health worker would be really beneficial. So that's something we're going to be discussing.
Okay.
You met Doug, who's our regional inspector. So far, things are going great. We're working on getting him trained. He's been out on a couple perk tests with me, food inspections, working on getting him geared up for that.
Okay.
And then just regarding the state, like DPH, it sounds like they're going to continue funding these shared services. They really are trying to ramp it up. They're trying to ramp up training programs throughout the state, so it'll be really interesting to see what they end up doing there.
Okay.
And then the other update that I received an email this evening is that Massachusetts had its first West Nile virus positive mosquito sample of the season. It was in Easton, Mass, so Bristol County. So right now there's no risk change, but just be aware, right? Practice good mosquito prevention practices, so using repellent, wearing long sleeves, avoid being outside between dusk and dawn, draining the water, those types of things. And other than that, there are really not too many additional updates. Continuing to do our regular inspections, food, housing, septic kind of take up the most. And yeah, those are the main reports. And then I know next is permits and stuff, so I just also want to discuss the next meeting dates. So the next one I have for August 3rd, that's the first Wednesday. The one I'm looking at to see if we can maybe down the road potentially adjust is the September 7th one. So I'm actually getting married the weekend before, so I don't know if I'll make it back for that meeting. So I was hoping we could push it by a week
Look at
if
her.
possible.
Shame, honey.
I just thought, let's plan ahead, just because I know schedules are difficult.
Yeah, especially with summer. And actually, I believe I took time off that week, but let me just look at my schedule. Yeah, I'll actually be in Maine for the next meeting, but if Dave and Dina are here, are you?
August 3rd,
Yeah.
Yep.
I'm on 3 to 11.
You're working 3 to 11. Okay.
So August 3rd doesn't work?
No.
Okay, so what date in August works for both of you?
10,
The 10th?
17.
I could make the 10th work.
Okay, so I'll reach out to Dave to see if the 10th works.
I'll be just coming home from Maine that day, so I'll come right here.
And then for September, would the 14th work?
I'm on 3 to 11.
or another, like the 12th or the 13th.
I'm available anything that week.
I can do the 12th or the 13th.
Yeah.
Okay, so let's do the 13th.
Good.
Okay.
I'll confirm with Dave.
That's fine. Yep. So 13th.
So it'll be 8:10 and 9:13.
Sure.
Okay. And I'll just confirm with Dave.
Yeah, and then just send an email out just to confirm those dates so I can make sure I
Yes.
plug them in and
Yep.
we're good to go there. Okay.
Did you go back to China Sea or China Wall, or you had sent an email about their
Oh.
inspection?
Yeah, Meiji. is
May.
Oh,
yeah.
Meiji. Oh, it was the other. I was thinking of the other
Yep.
restaurant. Okay.
So they have hired a consultant. The first consultant, it didn't work out, so they have now, another consultant reached out to me today, so they're gonna be working on getting the HACCP plan written up for them. I went out, was it last week, just to follow up to see how they were doing. Their sushi rice was at a proper pH. They had the necessary materials there. So now it's just getting their HACCP plan written as they would like it, right? Because you can do it different ways. There's not one set way you have to do it. I mean, there's certain parameters. And so just getting it updated and trained on how they actually do things.
Okay.
And I'm planning, trying to go out tomorrow to do a reinspection.
All right. Thank you.
Okay. And then the next item, I think we have a couple
Permits?
permit
Couple
waiver
permits?
requests.
Oh, permit waiver
Like
request.
fee
Okay.
waivers from some nonprofits.
Okay.
So is it just two? Yeah. Okay. So it's Good Shepherd Episcopal Church. You can see
So
theirs.
just one?
And then
Okay.
the Oxford Ecumenical Council,
Oh, the food shelf.
the food shelf.
Okay, so that's one.
So this is saying waiving the 25
Yep.
that we've set for churches.
Mm-hmm.
For what? Because they're saying that they don't serve.
Yep,
Sell
and they're
food?
they're nonprofit.
Nonprofits are 100.
So, but they're also a church, so that bumps it, right?
So my
25.
understanding has been that it's been the practice of the board that if a church or nonprofit requests the fee to be waived, that you do waive the fee.
Okay.
It is unusual to charge nonprofits a fee.
Oh, this is 100 on here.
Yeah, that.
But then there's a separate church, that's the
Yep.
other.
And I think we might have, that is the, not the updated fee schedule.
Oh, okay.
And I think we did bump down the nonprofit, but with the understanding if they needed a waiver, requested a waiver, that they could.
Okay.
And a lot of the churches, I find they have a food permit in case, but a lot of what they do, like coffee hour, that
Yeah.
really doesn't require a commercial food permit, but they just have it in case they ever want to do a soup kitchen or a church dinner or something like that.
So all of this is up to date. It's just the waiver piece.
Yep.
Gotcha.
And so if you vote to let them waive the fee, then the permit is right there and you can sign that as well.
I'm good with that.
And then this one's the food shelf.
It's a food permit. Even though they don't serve food?
No,
Because they
but
give
they're,
food?
yeah, yeah. It's kind of like when you market basket and not food service, food retail.
Yep.
Yep.
Which, that gets tricky too,
Yep,
because
it
technically
does.
all food that we permit, even restaurants, is considered retail, but then within retail,
Yeah, it gets tricky.
it's retail.
I'm good with this one.
It's all the food ones.
It's all the food ones.
Yay.
Warm up the wrists.
All right. So, sorry. I will entertain a motion to waive the food permitting fees for Good Shepherd Episcopal Church and Oxford Ecumenical Council for the 2022 year.
I make the motion as stated.
I'll second it. Any discussion?
No.
Nope, with there being none, roll call vote.
Dina Costa, member, yes.
Carrie Singer, chair, yes. Approved. All right, so we can sign these, right?
Yes. We didn't have any correspondence this time, did we? Oh, for the, no, not yet, no. For the plumbing, right?
Yeah. We're losing.
These two are all set.
Oh my god.
There you go.
Should be about 80 in there.
Oh, gee, thanks.
I think we're, almost everybody has renewed.
Okay. All right, sorry, I might have to call my brother right
I can go.
now.
I can sign while you call.
They're bringing my niece to the hospital, so.
Do you have to go?
No, I'll call him after. There's nothing I can do. She's not taking her oral antibiotics, so they're gonna have to.
Yeah. Poor kid.
How old is she?
5. I tried convincing her today, it didn't work.
Auntie Carrie.
Any issues here?
No,
Okay.
not currently.
Actually, it was probably
2.5.
about this time.
There maybe it's just the time. Time of night. Could be.
clindamycin.
It's disgusting.
And they can only flavor it with blue raspberry, and she doesn't like it. And she wants bubble gum only, but they can't do it. And she's 5, so she's spitting it out.
Can't blame her.
No. This place is always busy.
Oh,
El
that's
Patron, always busy. I go over there, especially on the weekends.
It's always good when they're doing well.
I know, I feel the same way. It's like,
I know, yeah.
you saw them like getting ready to open and they were talking about how long it was taking.
Yeah, it took
Now
them.
It took them a long
Because now it's
time.
busy.
Their furniture and stuff was all backed up with COVID. That was what was a big holdup. Was
It's
the
really cool
decorations.
inside. Yeah, like-
Oh, have you been in there?
Yeah, like the wooden booths and all the decor and everything is very cool.
Is this a food truck off the hook roadside eatery? I'm assuming so. Just
Yeah,
never heard of that one before.
We've gotten a fair number of mobile food lately.
Is there a food truck festival coming to Oxford that we don't know about?
No, it's for various events, and some then
Events,
choose
yeah.
just to get the annual.
Okay. Oh, yeah,
Because
that's
they
true.
know they're going to be at like 2 or 3 events
Yep.
this summer.
Yep.
Or this year, and so it's might as well keep it.
Did we,
Do lobster rolls.
I don't know if they're.
Oh, they do.
Oh, they do?
Yeah.
You already, wow.
I've heard of it.
Look at you. I'm just a creature of habit. I go to the same places
you
all
do.
the time. It's awful. And I order the same thing all the time.
Well, if you know you like it, nothing wrong with that.
this just a late one for Pine Ridge for tobacco? Okay.
They only sell tobacco products seasonally. Wasn't too bad.
No. A lot of them are thick packets. Yep, got our exercise in. All right. All right, anything else?
Nope.
All right, so I will entertain a motion to adjourn our Board of Health meeting at 7:05 PM.
I'll make the motion as stated.
I'll second it. Any discussion?
No.
Nope, with there being none, call for the vote.
Dina Costa, member, yes.
Carrie Singer, chair, yes. Meeting adjourned.